Hi guys, so straight up, let's jump to severe malaria. So severe malaria it requires prompt diagnosis and management of the specified complications, which is very vital. And quinine is the recommended treatment for severe malaria. So what you're supposed to do is supposed to give quinine injection as loading dose of 25 milligrams per kg IM, then refer. If you're in a clinical setup, you need to refer to a more specialized facility. If not case, you can continue the maintenance dose of 10 milligrams per kg 8 hours. So management, basically you reduce temperature in hypopyrexia if it's present, maintain fluid and electrolyte balance, especially if there has been any significant fluid loss. You also monitor output, should be at least 30 mils per hour. If hydration is inadequate and oliguria persists, give furosemide 40 to 80 milligrams IV start. If there are any signs of convulsions, use diazepam 0.3 milligrams per kg, IV or IM, or rectal 0.5 milligrams per kg. So, in presence of hyperglycemia, what you're supposed to do, you're supposed to monitor glucose regularly. Large doses of dextrose may be required, 25%, 2 milligrams, 2 mils per kg, or 50% dextrose, 1 mil per kg. In cases of anemia, you monitor HB regularly, transfuse if HB is less than 5, and if patients develop cardiorespiratory distress, they present with grunting, also flaring, chest indrawing, and heart failure. So check blood slides for malaria parasite very frequently on a daily basis to confirm parasitemia if it's falling down, basically the level of infection if it is falling down. So the management of adults with severe malaria must be appropriate to each complication that develops, and quinine is not contraindicated to any form of pregnancy. Fluid and antimalarial drugs are given as well to children, and IV quinine should be given in several doses. So first of all, the first dose is supposed to be 20 milligrams per kg in a half liter of fluid or in 5% dextrose. It's given over 4 hours to a maximum of 1,200 milligrams. You then give 10 milligrams per kg in in a half liter of fluid over 4 hours to a maximum dose of 600 milligrams, 8 hours after commencing the initial dose. So you repeat 10 milligrams per kg 8 hourly until the patient can take orally, and change to oral AL, full dose or oral quinine to complete 7 days therapy. So assess fluid frequently and regularly, and include urine output, which is very vital. So in children, you need special attention to the complications. So if the patient cannot be weighed, loading dose should be 900 milligrams followed by 600 milligrams 8 hourly. You also monitor for correct hypoglycemia with 50% dextrose in a ratio of 1 mil per kg, and each infusion of quinine should be given over 4 hours. So use quinine IM or IV drip. If it cannot be monitored or fail to get an IV access, you can give quinine intramuscular. So the dose for adults above 60 kilograms should not exceed 600 milligrams, and quinine hydrochloride may be given in as an IM in cases where it's an emergency. So oral quinine may be introduced intragastrically by NG tube in situations where the parenteral quinine is not available. Uh, Also, you can also look out for renal failures because the condition affects the renal system harshly. So chemoprophylaxis, anti-malaria prophylaxis should be given in different setups. So all non-immune visitors to malaria's areas that are prone to malaria, should always be given prophylaxis. Long-term residents or more staying more than 4 weeks short-term residents staying for less than 4 weeks. So patients with sickle cell disease and thalassemia, children with impaired immunity, such as those having HIV and AIDS, leukemia. So patients with hyperimmune malaria syndrome, leukemia, and splenectomy, pregnant women should also get this prophylaxis. So prophylaxis regime is basically antimalarial. For those at risk is mafloquine, 250 milligrams, given weekly starting 2 weeks before the travel date to a malaria-prone endemic area, and it is continued up to 4 weeks after return from a non-malarial area. So basically, for patient education, you should always seek early treatment for fever, cover exposed skin in the evenings by wearing like a heavy cloth on top. Use long-lasting insecticides. Also treat your nets. As a community, they're supposed to participate in indoor residual spraying in endemic prone areas. Thank you. I hope you've learned something.